Thanks for inviting me here today. I'm sort of here on behalf of the Department of Health, but also on behalf of myself as the Chief Social Worker for Adults in the Department of Health. I'll just say a little bit about that role. It's a new role. We've only had a Chief Social Worker for Adults for about 2 years, so I'm just past my 2-year anniversary. I've got 3 things I'm supposed to be doing in the department. One is to provide a voice for social work within the department, which, as you can understand, is very heavily dominated by doctors and nurses and a very medical health perspective on things. So trying to influence and advise around policy that has social work and social work matters at its heart. Also to continue the reform of social work education training, post-qualification, knowledge and skills and continuing professional development, and to try and reform its ongoing reform around social work, I have to tell you. And then finally, to try and improve the understanding both of local authorities, health organisations, but also working with service users and their carers and families and the general public to get a better understanding of the contribution that social work can make to trying to improve people's lives. So this morning I'm just going to cover what the Department of Health is doing to promote health and well-being of older people with learning disabilities. But I suppose Christine's covered a lot of the stuff I was going to say anyway, the kind of invisibility of people with learning disabilities anyway, as we refer to them here, but also very much so older people generally, and now very specifically older people with learning disabilities. And their particular needs, I think, have not really been picked up very well at all, particularly around identifying their needs and working with them, how to respond appropriately, and then what are the right sort of services, responses that should be in place. And can you just adapt what's been around for older people for some time or not? And even older people themselves who don't have a learning disability are starting to find those services too one-dimensional and not really responsive to them as individuals. And of course, I think older people with learning disabilities share some experiences of older people, but as Christine quite rightly highlighted, they have very different histories and different experiences, so that needs to be attended to when you're starting to respond to them. I remember when I was a young social worker 35 years ago, one of the first people I had to work with was an older person with a learning disability who was leaving a long-stay institutional hospital in Lancashire. And I met with her and we started to kind of work together and talk about how she might like to live her life, because she was going to leave an institution that she'd lived in since she was 9 years old, and she was now in her early 50s. So it was going to be a very big dramatic change, and I really had to work very hard to understand her life experience, to work with the support staff to think about how we could support her to have the sort of life that she could have without her really understanding what was possible. So that was a real challenge, and it took a lot of time. And I think that kind of patience, engagement, that personalised response to that individual, working with them very carefully to understand what matters to them, what's possible, who cares, and what can you put in place to support her. But one of the interesting things was, as Christine highlighted, companionship, friendship, building a network, a social network was the thing that really mattered in the end, and we had to work to find ways to do that. So just very specifically on England, we currently estimate that there are over 1 million people in this country with learning disabilities, and that includes about 225,000 people who are children under 18. We know we're not getting it right. We've still got a situation where men with learning disabilities die on average 13 years sooner than men in the general population, and women 20 years sooner than women in the general population. And we know that 22% of people with learning disabilities are under 50 when they die, so still significant health inequalities with this population. And whilst we accept that people might generally live shorter lives in the general population, you know through your own work at Bild that people with learning disabilities are living longer than ever before. And of course, this is to be celebrated, as it is with the whole population. But it does mean we've got challenges ahead and we need to respond appropriately. We've got a 30% increase in the number of adults who will be aged 50 and over who will be using social care services. But very importantly, it's estimated that there will be a 164% increase in adults with learning disabilities over the age of 80. And it's a great thing that we've got there, but it also does mean we have to think carefully about how we respond. So the challenge is significant. We've already heard about the specific challenges and disadvantages that people with learning disabilities face as they age. But it is the department and this government's ambition to make this a great place to grow old for everyone, where everyone can get the right, excellent care and support that they need, and where they can be supported to live as independently to make the most of later life. So just as important, and particularly important, to address the needs of older people with learning disabilities. And I guess it's that one thing is if you can get it right for people, I always felt this when I was working in operational management, if you can get it right for the people with learning disabilities we're serving, you're going to be able to get it right for everyone. Particularly things around how we communicate, the sort of language we use, how we make things accessible. That was always my benchmark, and I think we really have to use that as our benchmark as well. But these are challenges not just for the individuals themselves, their families and communities, but also for local and national government and the private and independent sector, who are key partners in trying to support people. But having said that, you'll be aware that we had the spending review last week, the announcements from the Chancellor. It's very, very challenging times ahead. And local authorities particularly are challenged, particularly over the next 2 years. So whilst there was this intention to introduce what they call a social care precept, which allows councils to raise council tax by 2% above the existing threshold in order to spend that money on adult social care. There will be variations about how people respond to that ability to do that. But the government does estimate that this could raise nearly $2 billion a year for adult social care by 2019-2020. I think there's been enough commentary to say that that will vary, because in some places they raise a lot of council tax anyway because people pay council tax, but in some places a lot of people are not in a position to pay and they can't raise as much. So it does highlight the variation in terms of places like Liverpool, where they have a lot of difficulty raising council tax because most people simply are on housing benefit or on low incomes. But there will be some additional money raised as well, or provided through the Better Care Fund. This will be about $1.5 billion in 1920, and it's actually coming through the NHS, but will be directly provided to local authorities. So in an attempt to move towards providing more access to funds to increase social care spending in real terms, but to also look at a better integration between health and social care. The only other key thing I was asked to highlight was that there will be a doubling of the Disabled Facilities Grant. And for those of you who know about this, this is money that enables people to make adaptations within their property so that they can have more accessible environments to live in. Dementia is the other big area that the department's trying to do a lot of developmental work on. There's been a big challenge, Prime Minister's challenge around dementia and dementia care, and trying to improve the response that we as a society have to that. And we know that certainly people with Down syndrome are more likely to develop dementia in their 50s, and we need to take account of that. The Prime Minister is wanting to deliver a challenge on dementia for 2020, and there is a real ambition to make England a world leader in dementia awareness, care and support and research. So it's going to continue to be a priority for this government, and they have made some achievements. For example, over 1.25 million people now have become dementia friends. There are 120 communities that are seen as dementia-friendly communities. And the other big thing has been around the improvements in diagnosis of dementia. So a lot of things have been put in place to try and support GP practices and hospitals to make timely diagnosis and to provide the right support. And this is even more important, obviously, for people with learning disabilities, as they're seen as 5 times more likely to develop dementia than other older people. The personalisation one is quite an interesting issue. There's a big drive towards personalisation in social care. And I think that means different things to different people, doesn't it? I think there is something about it's just individual support, and is that right all the time? And it's a very commodified approach sometimes. But the other thing is, I think that's what it's all about, isn't it? That once you've met one person with a learning disability, or one older person with a learning disability, you've met one person. And that kind of importance of really tuning into, engaging, taking that time to understand and appreciate who this person is, what matters to them, and what's possible is going to be key to trying to get it right, alongside a much more strategic service development approach to what is the evidence, or what are the signals of what can really work to help people have the best possible life. The NHS and social care have been trying to better train the care staff and the health staff who are working with people with dementia and with learning disabilities. Certainly over 600,000 NHS staff have had training around better supporting people. There's much more investment going into research in this area, but it's interesting, and I will take this back actually, having heard about it today. It focuses very much on research in dementia, and I don't know how well that research then teases out dementia for people with learning disabilities and what might be the unique challenges there. Obviously, everybody wants to see people having equal access to GPs, and it was an interesting point, I think. The last place I worked in, through the enhanced service arrangement with GPs, they'd agreed to ensure that their patients with a learning disability got a double slot, if you like. So rather than their 10-minute slot, they got a 20-minute slot. There still might not be enough time, and we'd put in people to support GPs when people with learning disabilities were going for their appointments. So there was the right time available to properly explore with people what their responses should be. But there's a lot to do on it. I totally agree, and I think we've still got a long, long way to go. In terms of the health checks, there is a scheme in place for an annual health check for people with learning disabilities in this country, and I think it's variable as to how successful that has been, but it's certainly been introduced into the GP contract in 1011, and many GP practices are signed up to this. NHS England really is committed to trying to improve this, and they're continuing to try and work with practices where the evidence is that they're not really responding appropriately to the scheme. NICE guidelines. National Institute for Care and Excellence, they're particularly thinking about what they can do around working with older people and learning disabilities. And they're about to issue next year some guidelines around this particular area, which is around care and support of older people with learning disabilities, and they hope to publish it hopefully by October 2017. So I know I'm running out of time. I think the other thing I just wanted to highlight was the CARE Act, which is just in its first year of implementation, which is absolutely relevant to this group of people, and that really is a call to action to put the principle of well-being at the heart and the person at the centre of whatever engagement, assessment of need and care and support planning is in place, and that call to action that people must be equal partners with their carers and families, working alongside them to put in place what really matters. The final thing for me, I suppose, is about social work, and I would talk about this, wouldn't I? I think there's been a real paucity in thinking about social work practice and what are the best models of working with, using social work models of getting alongside people, engaging, supporting parents, carers, families to be on that journey so that the person really can have the sort of life that they want. And there's very little research on that, and one of the things that I will be privileging over the next 12 months is ensuring that we can specifically look at what are the most effective and approaches that really do deliver a better opportunity for people with learning disabilities. And I think social work in particular has failed to really step up to the plate and think about social work interventions and how social workers can work with people. So I'll end there because I know we're out of time. So thanks for listening.